All right. Paul, you should be seeing the red camera come on at any moment, and you can start when you're ready.
I see live on YouTube.
There you go.
All right. Good morning to everyone. I am delighted that you could all join us for today's topic. I think you all know the topic is prevention is the key to great health. Let me start off by introducing myself. My name, as Liz said, is Paul Bolig. I am a volunteer at the Chatham Council on Aging. I've been doing this. I've been volunteering for a number of years. Mainly my involvement has been in two areas. I am a SHIP counselor, and SHIP is the program involved with Medicare. And I help individuals when they are initially eligible to sign up for Medicare. I help them sign up. And if they wish, help them select a program, a Medigap, or an Advantage plan, and possibly a prescription plan. And during open enrollment, they have the opportunity to change plans. They can look at what they have and see if there are any better options for them. We do that during open enrollment time every year. And not this year, but most years, I also work as a volunteer, providing eligible individuals with doing their taxes and doing their tax return. So those are my main areas of involvement at the Senior Center. This expo today is a collaborative venture between Chatham Health Alliance, the University of North Carolina School of Nursing, and the Council on Aging. Before we get started, I want to give special thanks to two particular organizations, Alignment Healthcare and CapTel. These two organizations are gold sponsors, and thank you very much, Alignment Healthcare, CapTel, for all of your support. It's very, very much appreciated by Council on Aging.
Paul, Libby's on right now if she'd like to talk about CapTel a little bit.
Great.
You're muted, Libby.
Absolutely. It's Tuesday and a Monday, right? Hey guys, this is Libby. I am with CapTel North Carolina, and thank you for letting us be here today. My boss, Kim Calabretta, and I work in your area with the Council on Aging and also the Chatham County area in promoting captioning telephone service for those that are hard of hearing and deaf. For those of you that don't know what a CapTel is, it's hard to show you here. I don't have a presentation this morning, but I do have a picture. If you guys have ever seen anything like this on TV, this particular piece of equipment actually has been a huge blessing in my parents' life, and that's how I became part of the program. I worked several years for the phone company, local phone company, and then I also worked for my church part-time. But captioning telephone service, many years ago, about 15 now, that particular service has been in North Carolina, giving back to people who are hard of hearing and deaf. My father, who is 90 and 95% as far as hearing loss is concerned, in other words, he's almost totally deaf, started losing his hearing in his 50s. It is hereditary in our family, and unfortunately, I am starting to lose mine also in my 50s. I have already lost 40% on my left side. But captioning telephone came into our life about 14 years ago. And it gave my dad the ability to be able to communicate with people on the telephone, whereas he had not for many years been able to do that. His children were able to call him and have a conversation with him again. Whereas my mother at that point basically was taking the phone calls and relaying the information to my dad. Some of you can probably relate to that, or you know someone that had that challenge. And he was very, very blessed to be able to get this piece of equipment in his home. The best part about it, first of all, it is at no cost to anyone that needs it. Our services are provided at no cost to anyone that has a hearing loss, whether it be just a slight hearing loss or complete deafness. And that particular service basically does two things. It puts the captions on the screen, kind of like captioning television does. And it also has an amplified piece of equipment that is louder, and actually it can be changed based on tone to be able to hear the other person that you're talking with better. For example, my father has lost most of his high frequencies and doesn't hear my sister on the telephone. When he speaks with her, he has to read just about everything she says. However, as you can tell, I have a lower tone voice. And of course, my brother has a man's voice, which is normally lower tone. And he has no trouble hearing those tones. So he can hear us pretty well, but some things he just doesn't understand. So when he has a problem understanding us, instead of saying, "Oh, wait a minute, I didn't understand that, repeat that," or as he used to do, he would just say, "Hang on," and he'll look down and read what we said and then respond back to us. And that gives him the confidence to use the telephone again. At 86, my dad still handles all his transactions. He handles all of his business affairs. He recently has just retired from work, and he still handles all of his own phone calls. My mother passed away 2 years ago, and this particular piece of equipment has been nothing but a blessing in being able to stay in touch with my father. He doesn't live too far from me, but the whole point is that if he just make a phone call and wants to handle something on the phone, he can do that himself. If you guys know someone that needs our services, you are welcome to contact me or put your information in the chat here. And if it's okay, COA, I'll be glad to put my email address there. Or you can go to our website at www.captelnc.com. It's a real simple process. It explains how to apply for the phone, how to get it, and what happens once we send it to you. We don't just leave you hanging. We send somebody to actually install it for you. Or in these times of COVID where people are not comfortable with people coming in, they will offer to help you over the telephone with that. But if you guys know someone that needs our services, please let us know. We want to get it into the hands of people who need it while there still are no calls. Thanks, guys, for letting us come today. Y'all have a blessed day and a blessed week.
Thanks, Libby. If you could put your contact information in the chat box, and then we'll have that if people want to call at the centers too. So
thank you.
Thank you.
And Dale is out there now. Dale, would you like to share something real quick for us with everybody that's on the phone and on our Zoom?
Yes, I'd like to share something. I'm sorry about that. I was trying to unmute there.
Okay.
Yeah, my name is Dale Neal, and I'm with Alignment Health Plan, and we are a new Medicare Advantage plan in the Chatham County area. And we are very happy to be able to sponsor this, the Health Expo, and we are very excited to be in partnership with Chatham Council on Aging. Just if there's anything that I can help you all with as far as Medicare Advantage plans and telling you more about what we do, I will be more than happy to answer any questions. Also, we look forward to our partnership as far as sponsoring the senior games as well, coming up soon.
Yay!
Yes, so well, yeah, so we're excited to be here and excited to be able to sponsor the Health Expo, and we look forward to working in the future with Chatham Council on Aging.
Thanks, Dale. If you want to put your information in the chat box in case people want to get in touch with you, and then we'll also have that information at both of the centers.
Okay, will do.
Thanks.
All right, Paul, back to you.
Thank you. I just want to ask, do we have anyone here right now from Cora or from the Chatham County Health Department? We do not. Okay.
We actually have somebody from Triangle J Council of Government, so.
Okay.
Is that Chris?
Yep.
Chris, let's turn it over to you.
Hold on just a minute. Let me get her spotlighted.
I saw her earlier, but I don't see her now.
There, let's see. There she is. Hi, Chris.
Hi, everybody. I'm Krista Keefe McCusker. I am the coordinator of the Chatham Orange Community Resource Connections for Aging and Disabilities. That position is with Triangle J Council of Governments. And I can put my contact information in the chat. Residents of Chatham County and Orange County are always welcome to join our committee meeting, and sometimes we have guest speakers on various topics that may be of interest to you. So I'm going to put my contact information in the chat. If anybody would like to contact me about more information, please feel free. Thank you.
Thank you.
Thank you, Chris. So I think it's time to introduce our two speakers for today. Am I correct?
Sounds good.
Great. Well, let me introduce our two speakers. The first speaker is Anna Guevara. She is a nursing student in the UNC Chapel Hill School of Nursing. She is in her third semester of nursing school and has a background in recreation therapy. She is taking the course Public Health Nursing in Community Setting and is working with the Council on Aging this semester as part of this course to work on health promotion in the community. Our second speaker, and actually they're working together here, Dr. Julie Jacobson-Van is a faculty member in the University of North Carolina Chapel Hill School of Nursing. She is teaching the clinical practicum with a group of 9 students, Council on Aging, this semester. And earlier on, she was telling me all the other things that she's doing. She has extensive background in health and wellness programs. Anna and Julie will be talking about the Medicare annual wellness visit and evidence-based screening and other preventive services. So, Anna, Julie, take it away.
All right, well, thank you so much. And thanks everybody for being here today. Anna and I are going to kind of do a health and wellness trivia with you, talking about the Medicare annual wellness visit and preventive screenings. And these topics are a little bit intense, a little heavy. So we're going to do it in a question and answer format. And Anna's going to ask all the questions and she'll read all the options to you. And so we're going to leave your mics open so that you can, you know, yell out yes, no, true, false, whatever, or the answer. And then I'll go through a little more detail on each topic. We do have one handout on the Council on Aging, or not the Council on Aging, but our virtual health and wellness website that summarizes all of what Medicare pays for in terms of preventive services, and then contrasts it with what the actual recommendations are, because Medicare pays for more than actually what's recommended to provide flexibility. And then we'll also make available sort of the questions and answers. We don't expect that we'll get through all of these questions today, but we will do our best. So feel free to speak up, ask questions, ask clarification, because some of these topics are a little intense. Today it's the 5th presentation of our student group. It's our final one. So we have door prizes today for people that are physically here by phone or Zoom by the end of the session. So Jackie, I think, is going to take your names down and pull names out of a hat. And we have some hand weights and a yoga mat and some exercise bands. So I think there are about 6 different door prizes. So we will announce those at the end of the session. And if you're still here, then you will get it and we'll figure out how to get them to you because they're still at my house. So,
So I just want to make sure everybody knows, if you're joining us by phone, if you want to participate in answering, you do need to hit *6 to unmute your phone. And if you are using Zoom and you're muted, you need to hover over toward the bottom of your screen, or if you're on a Claris Companion, touch about a third of the way up from the bottom of the screen and your Zoom controls should come on, and you should see a microphone and a video camera. If they're red and they've got a line through them, you click them and they'll unclick. They'll turn back on. So back to you. And yes, we can do the drawing at the end. Thank you, Julie.
thanks. All right, Anna, get started with the questions. Thank you.
Okay, so the first question is, what is the main purpose of the Medicare annual wellness visit? And there are 3 choices. So the first choice is to get a physical exam, yes or no?
No.
No,
No.
no,
Okay. Second choice is to get your vaccinations or shots, such as a flu shot or pneumonia shot, yes or no?
no,
No.
No, no.
Okay. Third option is to learn about your health risks and work with your care provider to develop a personal prevention plan.
Yes.
true,
Yes or no?
Yes.
yes,
Yes.
All right, and I wanted to, hey, Jackie, do we have the slides? Can we put the slides up?
Oh, wait, I have to mute. Let me mute myself.
Jackie? She there? Liz? We
Yes,
lose-
give me a minute. Sorry, I was muted. Let me get those pulled up. I thought you were doing the slides. I will do them. Not a problem.
I didn't, well, I mean, I can pull them up on my screen if you want me to share my screen. I think I can.
Yeah, that
do-
would probably be better. That way you're in control of when you forward them and things, when you go forward.
Okay, all right. And I will try to put this on slideshow and hopefully, okay, can everybody see
Looks
the
great.
slides? Okay,
Yes. Yep.
let me
Perfect.
project to where we are. Okay. So this was the main question. So main purpose of the Medicare annual wellness visit, and everybody got it right. To learn about your health risks and work with your care provider to develop a personal prevention plan. Let me just check. Okay, so you're really going to work on a plan to figure out what vaccines or shots you need and when, which preventive screenings you need, and other preventive services. For instance, if you smoke, it might be that you have to set up a series of visits to work on stopping smoking, that kind of thing. And so you'll answer a bunch of questions about your health and several other things, but the main goal is to really develop that personal prevention plan to help you be as healthy as possible. All right, thanks. Any questions, anyone? All right, we'll move to the second question.
Okay. So when should you get your first Medicare annual wellness visit? There are 3 options here. The first one is after you've been in Medicare for at least 12 months, yes or no?
Yes. No.
no,
No.
Okay.
No.
The second option, when you turn 65 years of age, yes or no?
No.
no,
No. No.
no,
No.
Okay. The third option, in your first year, you have Medicare insurance, yes or
Yes.
no?
Yes. Yes.
yeah,
Yes, we do. Yes.
All right, that's a little bit of a tricky question. I heard a lot of yeses on the third one. And I'm going to scroll it back here. So in reality, the answer is A, after you've been in Medicare at least 12 months. And the reason is in your first year, you're enrolled in Medicare Part B, which is the physician or doctor's part of Part B. You're supposed to get what's called a welcome to Medicare preventive visit. It's almost the same as the annual wellness visit, but it's a little different. It's called the initial preventive physical exam, or IPPE. You get your IPPE, or welcome to Medicare visit, in your first year in Medicare. And then the next year you start getting your annual wellness visit, which focuses on prevention and keeping you healthy. So you really kind of get them the first year, but it's a little bit different visit your first year. Any questions about this one? Has anybody gotten an initial preventive physical exam or an annual wellness visit?
I have.
Yeah.
Yeah, I have.
Okay, great. So you guys all kind of know what this is then. That's great. All right, so Anna.
Okay, so our third question here. How often can you get a Medicare annual wellness visit? Again, there are three options. The first option, twice a year, yes or no?
No.
No. No. No. Mm-mm.
Okay. Second option, once a year, yes or no?
Yes. Yes.
Yes.
Okay. And last option, every 2 years, yes or no?
No.
No.
All right, sounds like we had a lot of people with the right answer. Once a year, and you have to wait at least 12 months after your last Medicare annual wellness visit before you get the new one. So they're at least a year apart, and you can get them once a year.
Mm-hmm.
Okay. All right.
Okay, moving on to the fourth question. Is the Medicare annual wellness visit the same as an annual physical exam? There are two options here. The first one is yes. Correct or incorrect?
Incorrect.
Incorrect.
No.
The answer is no.
No. No.
Okay. Yes, the second option is no. So,
All right. Sounds like everybody was saying the first one is incorrect, which is true. The answer is no. So usually the Medicare annual wellness visit does not even include a physical exam. There may be some measurements like your blood pressure is taken, your temperature, some of those things, but generally it's not a hands-on physical exam because the purpose is really wellness and health.
okay, so question number 5. Will the clinic staff draw your blood or do other lab tests as part of the Medicare annual wellness visit? Again, we have two choices, yes or no.
No.
Yeah.
No. No.
Yes.
Yes.
No.
No.
It looks like there's a mixture there. Generally, the answer is no. It's not supposed to include clinical like blood tests or urine tests. It's possible that during that visit, based on answers to questions, your doctor or nurse practitioner may schedule you for some tests after the annual wellness visit. Generally, you would not have lab tests during this.
No.
Okay, all right. Thanks for everybody's participation. We're going to go to the next question.
Okay, question number 6. As part of the annual wellness visit, some measures are taken. One example of a measure is your blood pressure. What are some other measures that might be taken during the annual wellness visit? There are 5 options here.
Blood sugar.
First one, yes, that is one.
Yes.
Height and weight,
Mm-hmm.
body mass index or BMI, waist circumference, which is yes, and then cholesterol level.
Yes.
Yes. No.
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 Check your one.
All right, so there were 3 answers that were correct. The first is A, height and weight, B, body mass index or BMI, not the blood sugar, but yes, your waist circumference, which is measuring how many inches around your waist, and not cholesterol. So the body mass index or BMI, it uses your height and your weight to calculate a number. And this is a screening tool because it helps determine your risk for developing certain health problems. If your BMI is higher, you are at greater risk of various health problems. And the waist circumference also is a screening tool because it helps determine your risk for health problems such as heart disease and diabetes. And if you've got more body fat around your belly than around your hips, it shows that you're at greater risk for things like these diseases. So that's why it's really important to work on, as last week, the focus, was it last week, focus on nutrition and 1 week on physical activity. Really important to be active and eat healthy and eat small portions to keep your risk down for certain health problems.
Okay, question number 7. So this question has a couple of options, and they're all correct. So I'm just going to read through all the answers. So it is, what types of questions or health topics do you think are included as part of the annual wellness visit? So I'm just going to go and list all the correct answers. Basic demographic information, age and race, how physically healthy you believe you are, how you are feeling emotionally, feeling angry, lonely, tired, or happy, health behaviors, tobacco use, physical activity, nutrition, teeth, brushing, alcohol use, sexual health, seatbelt use, home safety, your ability to take care of yourself, dressing, feeding, bathing, toileting, grooming, and walking. And the last one, things that help you live on your own, such as using a telephone, housekeeping, laundry, shopping, house cleaning, taking your medicines, driving, and handling finances or money.
So on that one, as Anna said, all of these questions are asked during your annual wellness visit. You probably complete a health risk assessment that asks you a lot of questions about you. And that's a main part of the annual wellness visit to help your care provider develop that care plan for you, the prevention care plan. Any questions about this?
No.
Okay, great. All right.
Okay, question number 8. What other types of simple screenings do you think may be done during the annual wellness visit? First option, vision screening, yes or no?
No.
No.
What was the question?
What other types of simple screenings do you think may be done during the annual wellness visit? So we already went over vision screening. Second option, lung cancer screening, yes or no?
No.
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 Okay. Hearing screening, yes or no?
No.
Yeah. They don't.
Okay. A simple memory test, yes or no?
Yes.
Yes. Yes.
Okay. Check-in how you walk to look at your balance and if you have any challenges walking, yes or no?
Yes.
Yes. Yes.
Okay. And then mammogram, yes or no?
No.
No. Yes. They didn't give me name.
No.
You guys have a lot of good answers. So you probably, if you've had the annual wellness visit, might remember standing out in a hallway and having your eyes covered and doing a little vision screening, not a big one, not like at your eye doctor, but you probably had a vision screening. You wouldn't have a lung cancer screening.
No.
You would have a hearing screening.
Mm-hmm.
Yes.
And then that simple memory test. Did anybody have to draw hands on a clock?
Yes.
Yes. Yes.
You all had to draw the hands on the clock and maybe remember some numbers or some words, things like that. Okay,
Yes.
simple memory test. And then the timed up and go is usually done for a walking where you sit in a chair, you stand up, have to walk one way and walk back. Anybody remember doing that?
Yes.
Yeah.
Okay, that's part of it to kind of look at your risk for falls. And then a mammogram is not part of it. So you guys are getting great answers here.
No.
All right. And then another question.
Okay, question number 9. So here are a couple options too, and I'm just going to go ahead and say they are correct. For those that can't see it, I'm just going to go ahead and read each of the correct options. So the question is, what are some programs in the community that your care provider may refer you to help reduce your health risks and help you take better care of yourself? So that includes preventing falls, nutrition or healthy eating, being more active, quitting smoking or using other tobacco products, losing weight, and programs to help you if you are having memory problems.
Yes.
Okay,
Mhm.
thanks. Yep. So those were all correct. We have, I think, 2 more questions on the Medicare annual wellness visit, and then we'll be talking about the screenings, which are probably a little more challenging questions.
Okay, question number 10. I will read this question. There are 3 options, actually 4, and I'll just go ahead and ask you if the option is correct. So the question is, during the annual wellness visit, the care provider may talk with you about advanced care planning. What does that mean? So the first option is the types of decisions you would want to happen with your health care if you have an injury or illness that prevents you from making your own health care decisions. Correct or incorrect?
Correct.
Yes.
Yes.
Yeah.
Okay. Our second option, you decide who may handle your finances when you can't handle them yourself. Correct or incorrect?
Correct.
Okay. Third option, you may complete some advanced care planning forms. Yes or no?
No.
No.
I didn't. No.
You're supposed to already have them.
And then your last option, you may identify someone that would help make healthcare decisions for you if you can't make them yourself.
Correct.
Yes.
Yes.
Correct.
All right, we heard lots of great answers here. So the answers are in blue. So with advanced care planning, it is really focused on decisions that you would want to happen with your health care if you have an injury or illness that keeps you from making your own decisions. As part of that advanced care planning, you wouldn't generally talk about your finances. You would do that probably with somebody else, but not usually as part of your advanced care planning. And I heard people say that they probably already have their forms completed, but if you don't, you would possibly complete those advanced care planning forms at that time. And you probably would identify someone that would help make those care decisions for you if you can't make them yourselves. It sounds like everybody must have already done this. Everybody have their advanced care plans done?
No,
Yes.
Oh, I heard 1 no.
I want to
Yeah.
know if you are in the hospital or something, and you can't speak, and you haven't made nobody speak for you, what did the doctors do? How did it go?
No, that's a great question. If you haven't completed one, you're in the hospital and you can't make a decision for yourself. Does anybody have a good answer for that?
I see your brothers and your sisters.
Yeah, next of kin.
Yeah.
Mm-hmm.
Ken, if you've got, yeah, somebody.
Wife.
Wife or husband?
Yeah.
Whoever.
Yeah.
Mhm.
You have your children.
Children. Yeah, even I know I have a 26-year-old daughter, and if she were injured and couldn't make a decision, I, as her parent, could not help make those decisions unless, and there are similar forms that you can have young adults, children complete, so that if something happened to them, that you could help make decisions. And I haven't had my daughter do that yet, but so I know in the case of her being single and older than 18 without a form, I could not be involved in the decision. So it's an interesting challenge. So we encourage you, if you don't have those forms completed, to work, to get your Medicare annual wellness visit and talk about advanced care planning.
Mm-hmm.
But Jackie.
What's that?
Are you there?
Jackie?
Well, whoever. Anyway, I want to ask the people that usually come out the wellness care, do they still make the visit since the coronavirus? Because I haven't seen anyone for a while.
What type of visit do you mean?
The home wellness. What we're talking about. Someone come. It used to be they used to come out and they would have you take all your medicines, and we'd sit at the table and they'd go through your medicines with you and want to know what it is for and that. And if they thought it was something you didn't need, they would sit it aside and write a note for your doctor.
Yeah,
they'd check our urine, they'd check blood pressure, even our feet.
Okay, all
And
right.
I'm not
house
sure which
call.
organization. Liz, do you know which organization or what part of was it, whether it was part of COA or whether that was the health department? Do you know who did that, Liz?
It's
I
insurance
should.
company.
All I know on my paper it said wellness care. I don't remember.
It might be
what
you're doing.
This is Bonnie, and I think that's run by your insurance company, because when we used to have United Healthcare, somebody made a visit.
Okay, yeah.
House
And
call.
I think it's run by the healthcare.
It's a house
So
call.
Mm-hmm.
Yeah, because whenever they would come, they would do out and like drawing the clock, and they'd test your memory, give you some numbers, and then you go ahead and talk. After a while, they would ask you about what they had told you. But always they had gifts.
A house call. That's a house call.
Okay, I'm wrong then.
It's a house call.
No, that's okay. That was a good question because that way it allowed everybody to be able to pipe in what they know. So thank you for being such a good team here at the Council on Aging.
Well, a house call and a wellness.
Yes.
All in wellness is the same thing.
Yeah.
No.
Was it a care manager home visit?
Yeah, home visit to the insurance company.
Yeah.
Yes, that's right.
It's run by the insurance company, but I still have a wellness visit with my own doctor. And
Yes.
that's just, I guess that's just the way the insurance does, I guess.
That's what I was going to say. Now, I haven't had anyone to come out lately, but I have had one at the doctor's office. They called me for a wellness visit. So maybe y'all don't know what I'm talking about.
Well,
but anyway,
maybe we can help you a little bit later too. Maybe
Who is this speaking? So I know who it is that's asking the
This is
question.
Elizabeth.
Elizabeth.
This is
Okay, Elizabeth. Okay.
I know what she's talking about because I
I
was.
do too, because I've had them.
I do too.
An annual wellness visit with the house call. The house calls comes from the insurance
To
company.
your house.
Right.
And Jackie, they would also give you like a coupon to a Walmart or different
Yes.
places,
Yes,
stuff
ma'am.
like that.
Yes.
Yeah, that's.
That's always a big plus. Now I know why you're asking. I don't blame you.
Elizabeth, what insurance company do you have?
They what?
Elizabeth, what insurance company are you using?
Edna.
Oh. Edna? Okay. We'll look at
Now
it and see if we
listen,
can find the answer. Oh, Paul just said that United Healthcare provides this service.
That's right.
Yeah,
United Healthcare Advantage Plan.
Yes.
I was with United Healthcare, and I had to change because of my husband. They stopped that on him at the hospital. Not only him, at the Sanford Hospital. They wasn't taking that anymore, so we had to choose another one, and we got Aetna now.
Okay.
Well, I've got Aetna.
Right.
He died.
So we're not sure if Aetna provides that service, but that's probably why it stopped if you're not with United Healthcare anymore.
Yeah. Absolutely.
Yeah. Yeah, well, I was enjoying that because, I mean, they were really nice.
It's possible that you could ask the doctor. A lot of the plans have what's called a Medicare chronic care management service. Where they're able to call you for about 20 minutes a month to talk with you about your health. So if you don't qualify for this other one, you might be able to get what's called a Medicare chronic care management phone call. So it might be what you're thinking about. All right, so we're going to ask one more question about the annual wellness visit and then move on to screening. So,
Okay, so this is a yes or no. So the question is, will you be asked to pay for part of the Medicare annual wellness visit, such as paying a co-payment, co-insurance, or deductible?
Don't supposed to.
No.
No. No.
Mm-mm.
No.
Sometime they might ask you.
No.
you
No.
guys are right. You should
It's free. It's free.
pay for your Medicare annual wellness visit. There shouldn't be a co-payment or deductible or co-insurance.
No. No.
So, good.
No.
So I'd like to know the difference between
What's that? Here.
difference between a wellness visit and a physical. Physical covers more stuff, I think, but could you tell me what they're supposed to be covering? Because sometimes I go get a feeling they don't touch me.
With the
You're
physical
right.
exam?
So what?
They say everything is done through your blood work now.
Right,
That's right.
That's what
They do what?
Yep.
For the, I'm sorry, you're talking about a regular physical exam?
Yeah.
Yeah.
And that's not covered, you said, or it's partly covered?
No, I would just want to know the difference because I think a physical exam covers more things than a wellness check. But I would just want to know what the physical cover.
Well, the physical exam is going to be different with different providers, but usually they're going to listen to your heart, listen to your lungs, you're going to check your belly to see if it's soft and feel your organs like your liver and things like that. But the annual wellness visit is really what's covered and what's encouraged much more than even those physical exams. Yeah. So we are going to switch to preventive screenings, which is kind of a little bit more challenging topic. There's an organization or an entity called the United States Preventive Services Task Force, and they are involved in developing the guidelines or recommendations for what preventive services you get. And a lot of times people get a little confused about what screenings are. Screenings are only the tests you get if you have no symptoms. So let's say if you've got a mole on your arm and it looks like it might be skin cancer. If you go to the doctor, that's not a screening. The screening would be if you have no signs or symptoms of a health problem and you go in for like a routine check of it, some kind of test, like a colonoscopy for colon cancer or a mammogram for breast cancer. So all of the things we're going to talk about now with screenings only pertain to people who don't have any signs or symptoms, because you can still go in to get things tested if you have a problem or think you have a problem. But these guidelines are only about actual screenings. Does that make sense? Anybody have any questions about that?
Mm-mm.
All right.
No, not right
Not yet. All right.
yet.
So, Anna's going to start with the first question.
Okay. How are decisions made about what screening tests are needed by people? There are 3 options here. I'll go over by each option and I'll ask if this is yes or no. So the group that makes screening recommendations is called the United States Preventative Services Task Force. Yes or no?
Mm-hmm.
No, I say no.
I don't know.
Mm-hmm.
No.
I quite understand it.
Second option. The United States Preventative Services Task Force is a government agency. Yes or no?
Yes.
Yes.
Yes, probably.
Yes.
Probably.
Okay.
No.
And then our last option. The screening recommendations are based on a group of physicians that are asked to make recommendations. Yes or no?
Yes.
Yes.
Mm-hmm.
Yes.
Yes.
Yeah.
Mm-hmm.
All right. Well, this might surprise you. The first answer was correct. So
Oh.
the group that makes the decisions is called the Preventive Services Task Force. And they are a completely independent volunteer panel of experts. People that are expert in preventive medicine, primary care, nursing, and other specialties. And they review scientific research and weigh the benefits and risks of a preventive service, and they use that scientific evidence to come up with guidelines, and these guidelines are continuously updated. It's not a government agency because the intent is to be independent and not be influenced by the government. And it's also not based on just a group of physicians that make recommendations. And I want to point out that sometimes, my phone keeps ringing and I keep hanging it up, sorry. Sometimes physician groups, like maybe a group of cardiologists, come up with a recommendation for screening. That might be different than the United States Preventive Services Task Force screening. So sometimes you may read like mammogram guidelines that are different from the task force, but the best scientific evidence comes from this task force. So Medicare recommends that all providers use these guidelines and not the guidelines made by groups of physicians, because the groups of physicians may have an incentive to do more tests. So you can trust that the guidelines from the Preventive Services Task Force are based on the best scientific evidence weighing the risks and benefits. Any questions about that? All right, next question.
So how does the task force rate or grade each preventative service, such as screenings and counseling services? There are 3 options here. The first one, there are 5 grades including A, B, C, D, and F that are similar to school grades. Yes or no?
No.
Yes.
No. I'm saying no.
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 The second option, each service is given a percentage score, true or false?
Say that again, please.
Okay, each service is given a percentage score. Is this true or false?
No idea.
Probably. What, no, what you get? I don't know.
Please
Okay,
explain.
I know it's a little tricky.
Please
Um,
explain.
The last option, there are 5 grades including A, B, C, D, and I. Is this true or false?
It sounds like it could be true. Yes.
Okay.
No idea.
Sounds like we've got consensus that it's the last one. There are 5 grades, including A, B, C, D, and I. And they're listed here. So A is the best, no surprise. So if one of those screening or preventive services guidelines gets a grade of A, then the physician or nurse practitioner should offer that service to specific group of people. So the evidence shows that there's a benefit to doing the screening and the benefit outweighs the risk. The B, they're still supposed to recommend that service, but the evidence is not quite as strong. And I don't know if you can see the C or if it's covered, but the C is complicated. It means that the task force, that the evidence really shows that the benefits may not outweigh the risks. In general, it shouldn't be recommended, but for some people that may have specific risk factors or may have a real strong personal preference for getting it, then that guideline or that screening test should be offered. But again, only to certain people. D is not good. That means that the risks or harms of screening may outweigh the benefits. And I means that they just don't have enough good studies done to know whether or not to recommend it. But Medicare pays for the ones that get an A or a B grade. All right, any questions about that? So this is how your physician or nurse practitioner should make a decision about what screenings you get. All right.
And now they want you to get a second opinion on what the position. You know, in other words, when I go to my doctor and he say one thing, my insurance wants me to get another. What's the word for it?
It would be second opinion.
Second opinion?
And that would be second opinion?
Yes.
And that
so
would be,
is that what you mean by that? What you just said?
Well, usually a second opinion is for something like surgery. So if your doctor wants you to have surgery or something that's kind of invasive, then you get a second opinion. But for this, the decision of whether or not somebody gets a mammogram or a screening for lung cancer, there is a document that says these are the people that should get it. So these would not involve a second opinion, but they're just saying that if a screening, let's say a screening guideline says an A for obesity screening, then it should be done. If it gets a D, then the doctor should not do it. Okay, does that make sense? So this helps the doctor know what to recommend. For instance, when you go for your annual wellness visit, they should be making recommendations based on these grades that are given to each screening guideline.
Oh, okay.
Mm-hmm. All right, next question.
Okay, so for this question, I'm just going to read the answer choices because they're actually all correct. So, question is, when we talk about the task force screening recommendations and what we say they weigh the benefits and risks, what are the possible benefits of screenings? So again, all these choices that I'm about to say are all correct. Screening reduces mortality or death rates for the condition. Early treatment of asymptomatic adults reduce early markers of the disease or condition. Early markers change in the body that may occur before a disease develops. Early treatment of asymptomatic adults reduce mortality, and changes in these early markers of a condition can lead to improvements in health outcomes and or reduce mortality.
Okay, and just to sort of repeat what Anna said, so when the task force, that preventive services task force, makes the recommendations, they weigh the benefits and the risks. And the benefits of a good screening would be that by screening, there's a reduction in mortality or death rates for that kind of condition, and that, or that early treatment. So the reason we screen is to find something early. And if we find a disease early, and if it reduces markers, and these markers are changes that occur in the body before the disease develops, such as maybe a lab test changes. So that, for instance, by doing early treatment, maybe it reduces those markers. Early treatment may reduce the death rate, and it also may change the markers, which could improve or reduce mortality. So the reason we do screening is by detecting something early, we can prevent people from having higher death rates. If, for instance, if by detecting it early, there's no really good treatment, then there's not a good reason to screen. Does that make sense?
Yeah.
Yes.
Okay. All right. So basically, then in weighing the risks and benefits, we're looking to see whether or not it really helps to identify a condition early and treat it early. And then next question.
Okay, for this next question, I will read it, and there are 4 options, and we'll go again, and I'll ask you if this is true or false for each option. When we talk about the task force screening recommendations and we say they weigh the benefits and risks, what are the possible risks or harms of the screenings that the task force considers? So, screening tests are not completely accurate, true or false?
True.
And I
Sometimes
can
true.
repeat the question again. So the question again, when we talk about the task force screening recommendations and we say they weigh the benefits and risks, what are the possible risks or harms of screenings that the task force is considering? So first option, screening tests are not completely accurate, true or false?
Probably true. Yeah, sometimes true.
Okay. Some people may have more tests, procedures, or surgeries that are not necessary, true or false?
True. True.
Okay. I'm hearing lots of true. So third option, extra tests and procedures may result in psychological harm, physical harm, or both, true or false?
True. True.
Okay. And then last option, some of these screenings may be costly for the patients, true or false?
That's true. True.
Okay, well, 3 out of 4 of those answers were true. So screening tests are almost never completely accurate because with screening, the intent is to get a feel for who might have a problem. And then generally, if you get a positive screening test, then you might have what's called a diagnostic test afterward. So usually when you get a positive screen, then you have more tests. You might have a procedure or some additional surgery to figure out if you really have the problem. And so sometimes those extra tests and procedures cause physical harm because you might have to have surgery. And what if the screening test wasn't accurate? You may have had unnecessary surgery. I know one of my graduate students last week had a positive mammogram or breast screening, and she was really upset and couldn't do her papers because she was really worried. And then she went back for more tests and didn't have breast cancer. But she went through a couple weeks of psychological harm of being worried about it. And the reason we didn't consider the last one true is that if you get these screenings that are recommended by Medicare, you should not have to pay for them. So that's why we didn't highlight that they're costly for patients. Your insurance company's paying for them, but generally you're not going to be paying for them. Any questions about this?
Well, what age is it that you stop getting the mammograms and things like that? Yeah.
Great question. And actually, we are going to ask you about the mammogram. And maybe we could just flip to that question. Let's see what question it is. That is what we have questions 15 and 16. So I'm going to skip ahead. And Anna, I'm going to have you ask question 15, which is about the mammogram. And 16.
That's what I've been wondering about.
Good question. Okay. Oops. Here we go. Question 15.
Okay.
Oh, wait a minute. Yeah. Go ahead.
At what age should women consider having a mammogram to screen for breast cancer? So we have 3 options here. I know a couple of you might have already saw the answer, but 50 years, 40, or 60?
50. 40.
I'll say 40. I say 40.
All right. And so the correct answer, this is sort of a complicated one because I'm going to talk about 3 different age groups. The task force, based on the best scientific evidence, recommends screening mammography every other year, not every year, for women ages 50 to 74 years. And this gets a grade of B, not even the highest of A. And so this one is controversial because a lot of people think, oh my goodness, somebody's trying to cheat me out of getting more tests. Well, based on the best scientific evidence of what reduces mortality and has more benefits than harm, 50 years of age to 74 every other year. Now, for the people that are 40 to 49 years, the task force gives it a grade of C, meaning that there's not really a major benefit over the harms for the 40 to 49-year-olds. So for somebody that's between 40 and 49, they should talk about it with their physician. And if maybe they're at higher risk, maybe they'll get a screening mammogram every other year. Now, if some of you are like me and you get a letter from your doctor every year saying you need your annual mammogram, no, mammograms for screening are not supposed to be every year, but they're supposed to be every other year. Now, for women 75 years and older, the task force gives it a grade of I, meaning there's not enough scientific evidence to show whether there are benefits of getting the mammogram or whether the benefits outweigh the harm. So There's not conclusive evidence, and that doesn't mean that if you have a question or a problem, you don't get tested. But if you have no family history and you have no symptoms, there's no really good evidence that says whether or not women 75 and older should get a mammogram. Is this kind of?
I just had my mammogram a couple of months ago, and the doctor told me not to come back. And I'm 77.
Okay. And
Julie.
Yeah.
I am going to have my mammogram as long as I have two good friends. They're both 80 and they both have breast cancer. So, you know, there's an example right there for me that as long as they're paying for mammograms, I'm having a mammogram.
And a lot of people have that belief that if I can get it, I'm going to. But the reason the task force comes up with these recommendations is that a lot of these tests are not accurate. And because, I mean, pretty much every screening test is inaccurate. That means some people will have a positive test when they don't have the disease, and some people will have a negative test when they do have the disease. And because they're not accurate, some people are missed, and some people will have a lot of extra procedures that they don't need. So that's why these guidelines are trying to not overdo the recommendations. But if that's your personal preference, then you talk that over with your doctor.
Yeah.
So, yeah, because these.
Well, listen, I made a mistake. I didn't mean mammogram. I meant colonoscopy.
Colonoscopy.
I'm sorry, I said mammogram, but when I got my colonoscopy a couple of months ago, he said I didn't ever have to come back, and I was wondering why. You know, well, I'm 77. That's the reason I asked the question: how old are you? When they stop those tests?
All right. Well, let's go to question 11 then. That's a great question. So again, there are guidelines based on scientific evidence that weigh the risks and benefits about when you should get them and when you should stop. But then you also have to think about your personal preferences. And there are some that are really critical, like prostate cancer screening. There are some major risks of getting screened. So we'll talk about that one as well. So Anna, do you want to read question 11?
Sure. At what age should people start to be screened for colorectal cancer? There are three options here: age 60, 50, or 65.
50.
50.
Yeah, say 50.
Oops. All right, going to where did I lost it here. Okay, that was question
11.
11. Okay, yeah, the correct answer is 50. So the task force recommends screening for colorectal cancer starting at age 50 and continuing to age 75 years. And the risks and benefits of all the different, there's a whole bunch of different screening methods these days. I know I had the colonoscopy, and that's pretty standard, but there are others. For people age 76 to 85 years, the balance between risks and harms are kind of even. So this one gets a grade of C. So if you're between 76 and 85, the decision to get screened for colorectal cancer needs to be an individualized one between you and your provider. And the people in this age group who benefit most are those who didn't get their previous screenings for the colorectal cancer. And people who are healthy enough to go through treatment if they diagnose you with colorectal cancer, and people who don't have health problems that would significantly limit life expectancy. So if somebody has a disease is expected to really shorten their life, it may be that colorectal cancer screening is not the best option. So between 76 and 85, it's kind of between you and your physician, but the benefits don't necessarily outweigh the risks.
I'm so glad to hear that.
Yeah. So, yeah, because you don't want.
I don't
would
want it.
The
I'm 81 almost.
81, and I would say that the colonoscopy to me wasn't uncomfortable. I was awake through most of it, but I don't.
It's a preparation.
It's a preparation that was not fun. And even though I said I don't want any anesthesia, the anesthesiologist gave me a little bit, and that made me nauseated afterward. But the colonoscopy itself was not bad. Yeah, it's the other stuff. So any questions about the colorectal cancer screening? So this helps you show that the recommendations your physicians are making aren't necessarily random. If they're following these guidelines, they're doing a good job. They're trying to keep you from going through extra procedures you don't need, and understanding that some of these screenings tools are not really accurate. And I'm going to go to, I think the other one that's really controversial and hits the news a lot is the prostate cancer screening. And let's see, that one.
Hey, Julie, this is Liz. I'm just going to interrupt you for a second. It's 12:30. I just want to be cognizant of people's times. So do you want to try to wrap up? You got another one to do, or how many more slides are you thinking?
We have a lot more, but can we just do one more and then call it quits? Because this one is probably hits the news all the time. It's most controversial. So let's cover this one, and then we'll have our notes available on the website. Okay.
Right, perfect. Thanks so much.
13. Yeah, sorry, we've got a lot of stuff.
Okay, 13. Based on what we know from science, is it recommended that men aged 55 to 69 years be screened for prostate cancer? So 3 options, yes or no, or this is a decision that's an individual one.
Say yes.
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 This one, and I've even heard some of the local hospitals advertise how men should get screened for prostate cancer. And that's the reason I wanted to cover this one, is historically all the evidence has pointed to no. And now, because there was so much political controversy by saying no, they're basically moving it to the decision's an individual one, that men need to discuss prostate cancer screening with their doctor. And so for 55 to 69 years of age, the answer is discuss it with doctor as an individual decision. But then for 70 years and older, the answer is a clear no. And so the reason is, when we look at the risks and benefits of screening, there are a lot of potential harms of screenings. If there is a positive screen, there's a lot of extra testing. Sometimes there's surgery. There's oftentimes overdiagnosis, overtreatment, and the complications of treatment can be incontinence and erectile dysfunction and many other things. And there was one study I looked at that I often share with students that showed if 1,000 men got screened for prostate cancer and 1,000 men didn't get screened, and they follow them up over time to see how many people die from prostate cancer and how many people die from other things, the numbers were the same between the two groups. So the screening didn't have an advantage of decreasing death rates. And in addition, but the men that got screened had so many additional tests and complications. So this is a really tough one that men 55 to 69 should talk with their doctor about, and really have a serious discussion about these possible complications if you have treatment. And for age 70 years and older, the answer from the task force is that no, they don't recommend screening, that the harms outweigh the risks. I mean, the harms outweigh the benefits. So.
Julie?
Yeah.
what is the website where we can see all the questions?
The questions, let's see. Well, we're going to post them shortly, but let me just get to, I'm going to stop sharing.
So let me ask this. Are you interested in the questions that we have not covered or the ones that have already been covered, Esther?
The ones that we have not covered.
Okay, I was going to ask, Julie, would you be available to finish the rest of this at another time slot if we could set it on the schedule? Because it seems like there's a lot of people that are really interested, and that's the kind of thing we want to make sure that we're doing.
Yeah, definitely can do that another time. And on our Health and Wellness Expo, under the wellness and screenings, one of the things that's already on here is the guidelines in terms of what Medicare covers and what the recommendations are. And this is a 14-page document that goes through all of the screenings. And thank Anna for helping me update this, because this is something I had developed maybe 6 years ago, and the guidelines change all the time and they continuously change. That's why we have dates in there. So that's on there, and we'll and as Jackie said, we can definitely schedule a follow-up and cover the rest of the questions, because there's probably about another 8 or 9 questions on these kind of difficult issues about what screening is recommended. And that's the reason for the annual wellness visit too, is for your physician to help set this up. But I think it's helpful to understand why things are recommended and why some things are not. It's not arbitrary, and it's not to save money, but it's to reduce your chance of having bad things happen from screenings and having extra procedures and tests.
Now let me go back to something. So we were talking about the in-house visit, and I'm not sure the correct terminology for it. Let me go back and see if I can find it. So according to, so we said, I think United Healthcare does it. So Paul said the United Healthcare Advantage Plan provides that service. And then Dale, from our Alignment Healthcare, he shared that they also offer that service through Alignment Healthcare. So I did want to offer that. And I would like to set another time up with Julie to finish this, because I think this was really, really valuable, and having someone that you can ask questions live, I think is wonderful. So I appreciate Julie being willing to do that. Paul, I think we're ready to wrap up, and then I can do the drawing here. I have the, let me highlight Paul again. Let me get to that point. Hold on just a minute. And I apologize, people. I am still learning how to do all these things. So let me spotlight Paul, and I'll remove the spotlight from Julie. All right, Paul, it's all you. And then when you're ready, let me know and I'll do the drawing.
Anna, Julie, thank you very much to both of you. And I have to tell you, these are the topics that you covered. A lot of them are things that we do not talk about as Medicare counselors. So I myself really learned a lot today. So thank you to both of you. I want to ask Liz. Liz, do you want me to skip a lot of the things that initially I was going to talk about, and we're just going to go down to the drawing at this point in time, respecting everybody's time limits?
Yeah, Liz had to leave. She had to go to another meeting. So yes, I'm going to make that executive decision and say, go ahead and we will skip to the drawing. Do you have anyone else that you're supposed to thank at this point, Paul? That would be one thing I just don't want to miss.
I do want to do that. Yes, I want to send special thanks out to Cora, because Cora donated the apples and the sweet potatoes for the goodie bags. I want to thank Poe Center for the recipes, and I want to thank the Cooperative Extension for water bottles. They all made those contributions today. So thank you very much. And, you know, at the very end, I also want to let you know that the goodie bags that are available, they're going to include a $5 Subway gift certificate, a Duke Center for Living Guest Pass, and other items. They're going to be available to all of today's participants at both the Pittsboro and the Siler City Senior Centers. And if you, for some reason, cannot get out to the centers to pick them up, give Liz a call and she will make arrangements to have those delivered to you. So just call the senior center and we'll make arrangements to have those delivered to you. So,
What was that, Paul?
what was that? Call the senior center.
What's being delivered, or what can be delivered?
Esther, so I can answer that. So for those this is the first session that you have attended for the Virtual Health and Wellness Fair Expo, which I believe, Esther, is this your first time?
This is my, well, I had half of one, and then this is my second one.
Okay, so I believe Catherine, Gregory, Carrie, and Paul should all be getting a bag. So we will make arrangements with you to get your bags offline. And then I'm going to go ahead and I'm going to do the drawing. You can hear me shaking all the names in the box. Can you hear that? I'm shaking. I'm being honest. Yep. I got your name in there. I promise. Julie, what is the first item we're drawing for?
Let's get the yoga mat here. Let me see.
Yoga mat. The yoga mat is going to Esther Carr.
Wow, my granddaughter will love it.
All right. Next item. What's the next one, Julie?
Okay, next item is a three-pack of looped resistance bands, and definitely thank Anna for donating these.
Woohoo! Way to go, Anna. And the winner of that one is Wanda Durham. All right, next.
Now we have a three-pack of a resistant band set that are similar, but they're not the looped ones. So these you tie.
Okay, and that goes to Robin Lito.
Okay.
Next.
Next, we have a 2-pound set of weights.
And that is going to Thelma Knight.
Okay, Thelma, let me grab the next two. And then I think.
I was missing her. I was hanging out with Theo, and I guess I was.
All right. Got another set of 2-pound weights.
And they go to Amber Horton.
Okay. Oh. So when you get your bag, I think your goodie bag has that that exercise book, and it shows you how to use those little 2-pound weights. And the last one are 3-pound weights. So for different exercises.
All right. 3-pounders are going to Brenda Seiler.
Okay. Wow. All right. That's it for our door prizes.
All right. Wonderful. So I have everybody's name down. If you can't stop at the center to pick up your prize, we will make arrangements to get it to you. If you don't want your prize, I can I can send it, I can redraw and give it to someone else, but we would love for you to have your prizes. Any other comments or suggestions before we leave?
Well, I just want to mention they're still at my house, so I need to get them to the center, and it might not even be this week because I'm kind of tied up every day. So probably is going to be next week. So
okay, so we'll have to say, hold your horses is what my mother would say.
Hold your horses.
Yeah.
Okay. Get them to the center probably next week.
All right, so we will let you know when they are available. I want to give Paul a nice round of applause, and Julie and Anna for such a great presentation. We are just so thankful, and we apologize that this went long, but when you've got such good information, sometimes that's what happens. So have a wonderful, marvelous day, and we're glad you all joined us. Take care.
Thank you.
Jackie.
Hold on, Louise.
Where can we get our bag?
Glenda, have you already gotten your bag? Have you already gotten one?
I got one not too long ago. We did get another one. Do we get another one?
Nope, you only get one for attending any of the 5 virtual Wellness and Wellness Expos on Tuesday.
Okay. That'll be fine.
Okay. Anybody else have any questions or comments? Louise, did you have a comment for me?
Oh, I need to talk with Liz, but I can talk with her later on. She can call me later on concerning the senior game.
To Liz, okay. All right, I'll make sure Liz knows that you need to talk with her, okay? Anybody else?
Okay. Cool.
Thank you for everything.
Oh, you are more than welcome. We're glad to have everybody here. This has been a wonderful program today.
Yes, it has.
Bye, Jackie.
Bye-bye. Miss you all. Can't wait to see we can see you in person.
Amen.
Take care.
Goodbye. Yes.
Yes.
All right.